The closure of the aortic and pulmonic valves contribute to second sound production. In the normal sequence, the aortic valve closes before the pulmonic valve. A good rule of thumb to remember is that left-sided mechanical events normally precede right-sided events. The aortic, A2 component of the second sound is the loudest of the two components and is discernible at all auscultation sites, but especially well at the base. Since it is a high-frequency sound, it is best heard with the diaphragm of the chest piece firmly pressed. The pulmonic, P2 component of the second sound is the softer of the two components and is usually only audible at base left. Its high frequency is also best heard with the diaphragm of the chest piece firmly pressed. A physiological split occurs when both components of the second sound are separately distinguishable. Normally, this split sound is heard on inspiration and becomes single on expiration. The A2 and P2 components of the physiological split usually coincide or are less than 30 milliseconds apart during expiration and often move to around 50 to 60 milliseconds apart by the end of inspiration. The physiological split is heard during inspiration because it is during that respiratory cycle that intrathoracic pressure drops. This drop permits more blood to return to the right heart. The increased blood volume in the right ventricle results in a delayed pulmonic valve closure. At the same time, the capacity of the pulmonary vessels in the lung is increased, which results in a slight decrease in the blood volume returning to the left heart. With less blood in the left ventricle, its ejection takes less time, resulting in earlier closing of the aortic valve. Therefore, the net effect of inspiration is to cause aortic closure to occur earlier and pulmonary closure to occur later. Thus, a split second is heard during inspiration and a single second sound is heard during expiration. Listen to the following second sound. The second sound will be split upon inspiration and usually will be heard as single on expiration. The physiologic split second is heard best at base left with the diaphragm chest piece. The following example represents a second sound splitting interval of 25 milliseconds. Now, listen to a second sound splitting interval of 50 milliseconds. Now, listen to a second sound splitting at 75 milliseconds. The following example represents a normal individual with normal respiratory variation or physiological splitting of the second sound. The next example is also that of a normal individual. The recording is from base left. A physiological splitting is heard with each inspiration. Breath sounds are heard in the background.